think? Should we wait another couple more minutes or should we go ahead and get going? I'm taking silence as it's good to go and we can go ahead and get going. So good morning, everyone. Happy Tuesday. Thank you for being here and welcome to the Telehealth Open Forum for clinicians and providers. It is good to have you guys here. We're going to go ahead and get started with housekeeping items. And just so everybody knows, we are going to be recording this session. So if Alma can, have you started recording, Alma? So it is so the session is being recorded as of right now. So just an FYI, the session will be recorded. So we wanted to go over the accessibility information. We do have interpretation available in Spanish. So on the navigation panel on your Zoom, you can click on the globe that has the label interpretation on it and select the language. We do have two interpreters, Paula and Natalie. If you are needing interpretation services and you're having to choose one of Paula or Natalie, we're asking you to start with Paula. So you're gonna wanna go ahead and click on Paula to begin with the interpretation services. If anybody is needing closed captioning in a specific language, that is also available within the Zoom. So you're just gonna have to click on the live transcript and subtitle settings right on the second picture that we have here on the screen. And I know we have a pretty big group today. So there's gonna be a lot of questions, a lot of comments. How we're wanting to monitor and then get called on is on your navigation panel on your Zoom. You're gonna see an option for reactions. If you guys can raise your hand, we're gonna be utilizing that to, if you're wanting to provide a comment or if you have a question and you would like to come unmute, we can go ahead and call on you so you can do that. So if you guys can give me a quick raise hand, again, it's gonna be located on the navigation panel. Perfect, I'm seeing under reactions, I do see quite a bit of raised hands. Wonderful. Okay, wonderful. Thank you so much for those that helped me with that. Get those raised hands. Okay, anything else that I might have missed, Alma? And the chat box, so I'm going to read what's on the chat. So my colleague Alma, the chat box is also available for you. We will have the team members watching the chat box as we go through today's session. So if you're wanting to ask a question on the chat, we'll be able to come back to your question, answer that question and kind of let everybody know. Read the question and also read the answer as we go through this morning's session. And with that being said, we're gonna go ahead. Does anybody have any questions before we get started with our Telehealth Open Forum this morning? All right, wonderful. I hope you guys have coffee, water handy. We're going to have really good conversation on the proposed change rules. So we're going to go ahead and get going with introductions. And I'm going to go ahead and pass it on to Diane's team to do some of their introductions. And then we'll go ahead, Deepak will do our introductions next.
Good morning, everyone. Happy to have this wonderful participation in today's session. My name is Diane Quiring. I use she, her pronouns, and I work at OHA, Oregon Health Authority, within a division called the Health Systems Division, and specifically our Medicaid section. So happy to be here. I've been working on telehealth related things for the last little over 3 years now. Let me pass it over to Janet.
Hi, y'all. My name is Janet Herb, and I use she, her pronouns. I am a policy analyst for the Medicaid Coordinated Care Organization, or the CCO operations. And I get to play ball with Diane while she does the telehealth, and it has been fun, and I get to learn all this new verbiage along the way. And happy to help answer any questions. And if you cannot answer them, I will definitely take them down and get back to you on them. And then now I'm going to pass it on to Edgar.
Thank you, Janet. My name is Edgar. Good morning, everybody. I recently came onto this team, the Medicaid fee-for-service quality assurance team. I work with Diane. Before that, I worked at Department of Justice for 3 years. Thank you for letting me be part of this meeting.
I was muted. Go ahead, Alma.
Yep, I was gonna say thank you, first and foremost, to the Medicaid team that's able to join us today and help us with the conversation that we're planning on having. Next will be the CPOP team. I will go ahead and get us started. Hi, everyone. Again, you've heard this already a couple of times, but thank you so much for taking the time out of your day to join us here today. I am Alma Ponce. I'm the Regional Outreach Coordinator with the Community Partner Outreach Program with OHA. I serve the Southeast region of the state, which is one of the most rural parts of the state, which includes Harney, Grant, Baker, and Malheur counties. I love this part of the state, and I also get to live on this side of the state. So I really love it that I live with the communities I get to serve. And with that, I will hand it over to Doctora Lara, who's here with us today as well.
Hi, good morning. My name is Andrea Lara. I go about Doctora or Dr. Lara. I use she, her, ella, and I'm the new provider strategist with the CPOP team. A pleasure to meet you all. Thank you.
And hello again. My name is Rosa Armenta. I am also a regional outreach coordinator, like my colleague Alma, with the Community Partner Outreach Program with OHA. I serve the Northeast region, again, a very rural community. I actually live in Hermiston, and I do serve Umatilla County, Union, Wallowa, and Morrow. So I've been serving my community for 10 plus years. I just love our community and the way we get to interact with the community, and the way that, everybody is collaborating, all the organizations collaborating together to provide resources. It's just been a very, very great pleasure to work during the pandemic, because this collaboration just kind of grew within the organizations here in this community. So very happy that I am here serving and continuing to serve my region as well. Then we're going to go ahead and go on to some of the objectives that we're going to have for this morning's meeting session. So we're going to review the background of telehealth. We're also going to be collecting testimonies and experiences related to telehealth services, as well as reviewing telehealth proposed rule changes. We are wanting to collect feedback for participants related to rule changes. And we're going to be talking briefly about public comment, which is going to be open on in April of 2023, so just next month. And then some of the ways that you are able to connect with us. We'll be able to provide more information on that and the different avenues that you can submit your comments or any other information that you would want to share about this proposed change rules.
All right, thank you so much, Rosie. And with that being said, we're going to jump into reviewing a little bit of the background, and I will hand this off to Diane.
Thank you, Alma and Rosa, for setting the stage and getting us rolling. So again, my name is Diane, and just to kind of review what has been happening with telehealth in Oregon specifically, but also our experience is similar to other states across the nation. So Even before the pandemic, which was, officially announced in early March or late April or February of 2020. So it's been more than 3 years. Even before that time, health care services were able to be provided using telehealth as a method for our Oregon Health Plan Medicaid participants. But it wasn't really used a lot. And then Oregon, like the rest of the country, shifted really quickly due to the pandemic to move towards seeing individuals via telehealth modalities when that was medically and clinically appropriate. And it was a big sort of steep learning curve for everyone involved: members, clinics, hospitals, etc. So, we've learned a lot over that time. Because of the pandemic, we also were able to file what was called temporary or emergency rules with the Secretary of State. And these administrative rules really guide what are the requirements for when OHA will cover and pay providers for health care services delivered using a telehealth method, whether that's synchronous audio visual technology, audio technology like a telephone, if that was the only thing that was available to the member or the patient, etc. So our temporary rules in March of 2020 just really helped clarify and expand that coverage. And then later in that same year, we did file permanent rules with the Secretary of State's office. And that was based upon input from community and providers and members. And so we had permanent rules that became effective at the beginning of January 2021, and then were updated again in 2022. So that brings us to now in 2023, we're looking at what are some additional changes that might be needed to our administrative rules to really move this continued coverage and to address some of the issues that people have experienced. Certainly, a lot of services have transitioned back to an in-person service, but there certainly is always going to be a need for and appropriate use of services still being delivered via telehealth. It's sort of like one of those cases, it's out of the box and it's not going away, and we wouldn't want to have that. It's been a benefit for both providers and members, along with some hurdles and challenges. So our goal here is to make sure that our members really have choices. So we want to preserve the ability for members who really need to have an in-person visit with their provider to be able to have that. If they're able and want to have a telehealth visit, we want that to happen as well, as long as it meets medical appropriateness, it's a covered benefit, etc. So that's a little bit about the background. So I think we can move to the next slide.
All right, thank you so much, Diane. And after sharing that information, we acknowledge that we haven't really had another opportunity since our last listening session with providers and consumers back of December of 2020. So I want to start off with giving us about 10-15 minutes to have some conversations about what has worked well for you these last few years, what hasn't worked well, any specific questions, concerns, or ideas to help improve the processes that we have in place. So we will open up this time for you. If you have anything you'd like to share, please feel free to raise your hand. Yvonne.
Hi, thank you. Thank you for this presentation today. I just wanted to put forth or just share a couple of things. The first thing is more kind of administrative, which is it's somewhat been a challenge to sort of keep on top of or track and see exactly, what services were covered under telehealth. That seemed to be very sort of difficult for me. I don't know for anybody else, but it was difficult for me to really verify what is actually covered by telehealth, like sort of even by CPT code, and being able to identify that. That was a little bit of a struggle, and maybe it was a learning curve for me just individually. And the second thing that I want to share is that it has been very beneficial to our population. We serve youth and their families. And for some, it's a challenge to bring their young child in. We deal with kind of extreme behavioral issues. And sometimes coming in for that is a challenge for our parents bringing the children in. And so telehealth in all types of services that we provide has been really beneficial for our families. And they've really enjoyed having the flexibility to hey, maybe call in and say, we were planning on coming in today. That's not working out for us. Can we do this telehealth? And just having that available at that last moment to switch that up and have that availability has been really beneficial for them. So that's all I had to share.
Hey, Yvonne, we didn't get to go and do introductions for everybody. Would you mind, and really good feedback that we received from you, so thank you so much. Would you mind stating your name and maybe the agency that you work for, and we'll go.
Sure.
Yeah.
So my name is Yvonne Hubbard, and I work at Oregon Community Programs, and I'm the Billing and Compliance Manager.
Thank you, Yvonne. I did see on the chat before I go to Heather, I know Ruthie Marks did raise their hand on the chat.
Hi, should I just speak in the microphone like this?
Yeah, I can hear
Hi.
you.
My name is Ruthie Marks. I live in Eugene, Oregon. I'm an LPC in private practice. I was working for a company when the pandemic started, and I played a big role in converting everyone to telehealth immediately, which was really challenging, but I think it worked out pretty well. Most of the clients that we were serving at that time were able to get on telehealth either by phone or video pretty easily. Most people have smartphones in this area. And now, since that time, it has benefited many of my clients. I'm able to serve people in different areas of the state now. I serve kind of a specialized population of severe chronic trauma disorders. And sometimes people aren't feeling able to leave their house. And so if they were scheduled to come in person, they can just get on video and still keep their appointment. So in other words, my attendance rate has greatly improved since telehealth has been more widely used. I guess that's all I want to say. Thanks.
Thank you so much, Ruthie. And with that, we will jump into Heather. I believe Heather had her hand up next.
I hope I'm the right Heather. My name is Heather Crimsley. I am in private practice in Corvallis, and I think that I would echo what's been said, that my clients, I transitioned, and most of my clients found using telehealth to be really convenient, and the no-show rate reduced because it was just easier for people to get to and from appointments. They didn't have to leave their comfortable space, their home or wherever they felt, where they were meeting me from. And I think that actually aided in therapy, like that translated to them being more comfortable and being able to talk about things in a deeper way at times. There are drawbacks. I couldn't see my client's whole body all the time, and sometimes that's something I would prefer to be able to see, but it didn't really inhibit the treatment. The things that were hard were, just through the pandemic, figuring out the telehealth coding issues, like the different changes in point of service and the modifiers, that still is confusing because it seems to change at different times with different insurance providers, and there's not a consistency between insurance companies, which is difficult for especially those of us, I think, in private practice who are solo and doing our own billing and also trying, to do the therapy. The other big thing is that I had a really hard time finding somebody at OHA to talk to. I faxed, I emailed, I phoned and left voicemails. And this is such a relief to have like Diane available and the rest of the team and have this space where we can ask questions and have a contact for, if we have questions that come up afterwards. But just to have an open channel, I think is really huge because, there's been a lack of information, I think, in the community in general, and the different providers, when I've talked with people, are not aware of changes or how the public health emergency is even affecting their practice. A lot of people are not following this, I think. And so getting the word out and getting the message to enough people that there's some accurate information going out there and some ongoing discussion and feedback is really helpful. So thank you for this.
Hi, Heather. Thank you so much for sharing that. I think it really means a lot, and we appreciate the opportunity to be here with all of you today and that you guys were able to take the time. But this is great feedback on where we can improve as well to provide the support that all of you as provider offices are needing to be successful with telehealth. So thank you. All right. And then, I believe it's Andrew.
Hey there.
Next?
Yeah, hi. Andrew Suchaki. I'm the medical director with the Clackamas County Health System, representing our organization, but also FQHCs in general, our qualified health centers. I really appreciate you having this forum. There has not been a lot of kind of opportunities to speak to OHA about this. I think that I really wanted to call out a couple things. First, just if you could speak to some of the federal impact that we may not have control over. There's two things I wanted to call out in particular. For the writing of controlled substances and the requirement of in-person visits before the initial prescription, unless it's for medications for addiction treatment. So that is something that the DEA had proposed language in late February that's supposed to come out later this month. I'm not sure where that's going to land when it comes to the buprenorphine exception, but even that is a limited exception. So just want people to make people aware of that what will change things significantly. The second thing is there's a lot of federal language and some stuff from the state too, talking about the difference between telephone and video. And representing organizations, ours included, that include some frontier area in addition to rural areas where broadband is just not possible or feasible, in addition to there being technology determinants of health issues with some of the patients and clients that we serve. Allowing some, creating we would really prefer rules that are created that strongly encourage the use of video, but allow an exemption for settings and lack of infrastructure and capacity. Thank you very much.
Hey, Andrew, thank you so much for sharing that and calling out the specific needs for those two areas. Rosie or Diane, anyone want to add to that? If not,
Yeah, this is Diane. Sorry. Quick to find my unmute here. Appreciate that, Andrew, and definitely hear your concerns about both the sort of unknown final ruling from the federal level regarding some of that prescribing prior to an in-person. We're kind of watching that as well, and I know our pharmacy team is on top of, because I've flagged it for them as well. So sorry about that ringing in the background, but and I think it is OHA's intent that that we allow for audio only when synchronous audio visual is not possible or appropriate, or the client isn't willing to participate with audio or with video. So appreciate that. We'll get on. There's lots of hands. So
All right, thank you, Diane. And Perla.
Thank you. So my name is Perla Andrade, and I am the director of the Student Health Centers here at Pacific University. And I just wanted to thank the opportunity for having telehealth. It has been very resourceful, especially for our student population. Thanks to telehealth, we have been able to see COVID positive patients for follow-up symptoms without having them come into the office while they're infected. Also, we've seen an increase of our students with mental health issues that we have been able to help without having to leave their dorms, medication follow-up. So those are quick appointments that save everyone time. And I hope we can continue to offer the services mainly for our student population. So I just wanted to say that this has been a very helpful tool to have here on campus. Thank you.
Thank you so much, Perla. Sorry, I was having trouble getting myself on unmute. We have a couple more hands up after 1, 2, 3, 4, 5. After these next 6 conversations, we'll move on to our next topic at hand today. So just wanted to call that out in the interest of time. So next I have Laura.
Hello, I am the Executive Director at Crossroads Treatment Counseling Services, and we work primarily with UII clients. And I really appreciate that telehealth not only is to help keep the members and staff healthy, but people who don't have a license, live in like Colton or Malala, they can still come in for their appointments through telehealth. I really appreciate that.
Thank you for sharing that. We really appreciate hearing those good success stories. So thank you. And next I apologize if I don't say your name correctly, Cecilia. I may have said that very, very wrongly. Are you able to come off of unmute? There we go.
I think so. Did I?
Yes, we
Can
can
you
hear
hear
you.
me? Yeah, hi, I'm sorry about that. My name is Sheila Andor. I'm a psychotherapist in private practice in Corvallis, and I have used telehealth extensively, and this has worked so well for my population. I primarily work with pregnant and postpartum women and the families, parents with toddlers. And just not having to bring a baby or a toddler to session has been wonderful for them, and not having to cancel when the child is mildly sick. Also for parents with school-age children, when the session is after school, or not having to juggle pickup times, or when the client has just a mild cold or some kind of sickness, or if they have issues with gas costs to drive to session. And the phone use would be just phone only sessions would work really great also for a lot of my clients. Thank you.
All right, thank you so much. And I'm going to try to pronounce your name correctly. Chilla? If I said that correctly, just give me a thumbs
Yes.
up.
Yes.
Okay,
Thank
perfect. Thank you. And next we have Sherry.
Hi, my name is Sherry Jennings. I'm a speech language pathologist, and I am a director of InReach Therapy. I'm also on the Oregon Speech and Hearing Association board. Just wanted to share some information from our team and our experience at our practice with being able to offer this service for our families. We provide speech and occupational therapy services to children in the greater Portland area, as well as Salem and the outlying rural areas. And telehealth has actually made it so that we can reach people all over the state who don't have access to some of our specialized care that we can provide. One of our therapists on our team has a specialization in working with deaf and hard of hearing and children with recent had recent cochlear implants, and that's kind of a subspecialty of a subspecialty. And so she's able to actually, see these patients in rural areas where they would typically have to drive for hours and hours to find a specialist like her. So she wanted me to just share that telehealth helps families be more consistent with appointments and allows for attendance even if siblings are sick. Allows for more flexible scheduling because parents don't have to think about travel after school hours or traffic, and gives access to those who don't have skilled professionals in their area. We have several families in rural areas, as I said. And then also it provides services in the home or community environment where it matters, with getting caregivers involved throughout the therapy session, which is wonderful. So I just wanted to share that, and thank you again for providing this forum for us.
Well, thank you, Sherry, for providing that feedback. Very appreciative. Lorraine, I have Lorraine up next.
Hi there. I'm a therapist in private practice in Eugene, Oregon, and I've been actually using telehealth before the pandemic, and it has worked very well for the population I work with. I focus my practice on folks on the autism spectrum who experience psychosis, may have diagnosis of schizophrenia or bipolar or other more challenging diagnoses. What I have learned prior to the pandemic and now is that the population I work with really benefits from telehealth. Often they report they have no transportation, and with the bus system in Lane County shrinking, there's less access to being able to get to a physical office. I have clients who have physical challenges, so being able to have sessions in their home is much more of a positive experience for them because they're not having to consider, okay, how much pain meds do I need to take to get to this appointment? Will I be comfortable in the the rig that's getting me there? Will I be exposed to other people, which could compromise my immune health? My clients may experience, extreme social anxiety or agoraphobia or paranoia, and being able to have sessions in their home allows me to provide care that they would not get because they don't want to go out. Since the pandemic, the clients that I've worked with that have reported that telehealth is so useful, they have kids at home, and so they're able to juggle childcare much more smoothly with partners or family members if they are single parents. Many folks have gotten jobs, yay, but they're remote jobs, which means leaving work at home to go to an appointment would be a loss of income that they're not willing to take on. And then there's also the whole piece of if you have a session out in the community, you have to actually take time off for the transportation along with the session time, and that's a piece that that is very financially challenging for the population I work with. And lastly, Lane County, where I work, is 4,722 miles wide, and there are many folks who have zero access to in-person care because there just is no therapists in their areas. I also work with clients in rural areas like Umatilla, Pendleton, and they report, there aren't therapists who have my specialities for them to provide support, so they would be without service because there just is so few rural therapists who work with the population I do. So, and then lastly, one big piece is access to technology. I happen to have started a nonprofit where I refurbish computers in my previous life. So I have access to low cost technology that I've been able to purchase for my clients. And then it becomes like part of my business hardware pool. And once they're done with the laptop, they return it to me. But that has been a challenge as opposed to, you know, a positive aspect of telehealth. There is, of course, a national program to try to get technology to folks, but that has been in and of itself very challenging to connect the client with the distributors in a timely fashion where they're not going multiple times out to try to get a tablet or a laptop from someone who's distributing them. And thank you for this opportunity to have this forum.
Oh, thank you, Lorraine, and thank you for highlighting all those various other, you know, barriers that members face when having to go to an appointment physically, and you know, the accessibility that they now have. And it's a very positive change to have to been able to access telehealth services this way. So thank you for that feedback. And then I have now Nasi.
It's Nacy. Can you hear me?
Nacy. Yeah, hi Nacy.
Perfect. My camera's not working or else I would turn it on. Thank you for having me today. I am the training and education coordinator here at Lane County Behavioral Health. So I'm definitely aware of the kind of struggles Lorraine shared just now on how wide our county is and how rural it can be. So telehealth has definitely helped us increase access for folks needing to get mental health care, and has also helped reduce a lot of barriers, not only just for therapy, but as Andrew was kind of stating, access to medication. We have a pretty significant shortage of not just therapists here in our state, but medication prescribers as well. So the ability to have telehealth options has really allowed us to contract with providers who are maybe not located directly in Lane County. So that's definitely increased access to that. My concerns are kind of similar to what Andrew stated around the upcoming prescription rulings and kind of the need for in-person appointments. And then I'm really hoping that you'll address what you sort of did when you were answering Andrew's question, but there's some confusion in our clinic on what services are appropriate to be provided via telehealth, what's reimbursable, and then kind of also separating that out via just phone or kind of the audio video. So I'm hoping that that concern might be addressed a little more in depth as we go on today. Thank you for having us.
Thank you, Nasi. Nacy, right?
Nacy, yeah, you're fine.
Nacy, okay. Diane, I don't know if you want to take on Nacy's question now or address it throughout the session.
Well, I can take a stab at it just briefly. I know, again, I think, you know, we're kind of watching what is happening at the federal level in terms of those final rules around prescription of controlled substances. And in terms of, you know, what's covered, what is considered medically appropriate or clinically appropriate, that really is outside the scope of OHA's sort of guidance. Other than to say it, you know, we still utilize the Health Evidence Review Commission, HERC's guidance in terms of what is on the prioritized list for coverage, and really in the rules, you know, sort of defer to the licensing body or the credentialing body because different practitioners may have different things, you know, state by state in terms of what is within their scope of practice regulations. So, you know, what may be considered appropriate for one type of practitioner, physician, psychiatrist, licensed clinical social worker, et cetera, you know, physical therapy, speech therapy, et cetera. It really is dependent on those licensing boards in terms of what is an allowable service for provision via telehealth. And I'll stop there. So.
Thank you, Diane. Appreciate answering that question. And we have up next, Lisa Montoya.
Hi, my name is Lisa Montoya. I'm the Clinic Administrative Manager for Dynamic Self Recovery. We've been open for about 2 years, and we serve the Lynn and Benton counties. We have found that telehealth is really helpful, especially for our clients that are in the rural areas, so like Sweet Home, Lebanon, that don't have cars or can't get to their appointments, including people that don't have childcare. So we're a mental health and drug and alcohol clinic. One of the things that we are having some issues with as well is just being able to know what CPT codes and modifiers we're able to use that will be covered by whether it's video or phone appointments. And we want to be able to give our counselors kind of like a guide for them to be able to use, obviously, especially because we are using so much telehealth. So I don't, we mostly bill Oregon Health Plan and then Open Card and IHN, and that's kind of just where we're at with that. We do appreciate that you guys have this for us to be able to ask questions and talk about that. So yeah, that's my part of it.
Thank you for sharing that feedback, Lisa. Nancy Longoria.
Good morning. Well, I guess it's afternoon now. I'm Nancy Longoria, and I'm a clinical supervisor for Lifeways in Malheur County, another rural and frontier county in Oregon. And I think the advent of telehealth gave us much more flexibility in our ability to provide services to this large county, but we still have outlying areas with limited internet access. I think for the rural frontier counties, the more flexibility in the types of ways we can provide services, the better. I wanted to kind of shout out to Carrie Bloom, who mentioned the workforce shortages right now. So currently we definitely have more availability via telehealth. And if we're required to refer, we don't just do telehealth, but if we're required to refer, that doesn't mean that that referral is going to give that person the services they need, given the lack of workforce that are doing in-office, in-person work. So my concern is just that, kind of making rules about referring when that doesn't necessarily mean that that client's going to get the care they need in person because there's not an available provider in the county. So that's just my concern, is overall the workforce shortages, especially in my particular county and all the rural frontier ones. So thank you for having this forum.
Thank you for bringing your concerns to the table. We appreciate you, Nancy. Well, thank you. Alma, I know we have some conversation on the chat. Should we address that, or should we continue moving forward based on our time?
I think given the interest of time, let's jump into the proposed rule changes, especially it's a good headway given what Nancy just talked about, which is going to lead us into one of the important talking points as to why we're here today. I really want to acknowledge all the good comments and conversation. I've been able to go through the chat and been able to engage in some of the conversations, and I hope that we'll have another opportunity where we could digest some of this a little bit more. So let's jump into the next portion. So Diane, do you want to take this and share the first proposed change?
Certainly. So as if we could go to that next slide, I have too many screens open here. So as you can see here, one of the proposed changes to the rules has to do with what Nancy was speaking to. If a member really needs or desires that in-person visit for a covered service, and the provider only offers telehealth delivered services, then the proposal is to, again, to sort of protect the member access to that in-person service, is to have a referral from the telehealth provider to a provider who offers in-person services within 2 business days. I appreciate, and we are aware of the workforce limitations, then, you know, getting a referral doesn't necessarily mean you're going to get an appointment within a reasonable amount of time. But and so, you know, rules may not be able to address that workforce shortage, but we are looking to do some measurements around that. So the real question is, you know, if we incorporate this change into the rule, will that help support members to receive care in a way that meets their needs? So we can have conversation.
Thank you, Diane. So with that question in mind, we do acknowledge that there's so many different other aspects that could affect this, but we want to focus on, will this change help those members receive care in a way that is actually meeting their needs, and how you feel about that. Carrie, your hand pops up.
Hi, thank you again for this forum and for taking my question. In our community, I'm a division manager in Polk County for the health services. We are the only provider within our county. What this would do is it would impact our capacity to serve our community, because providers who are exclusively doing telehealth would refer everyone to us. We are also the only provider in our region doing same-day access. So we are at a breaking point with workforce shortage, and this would inundate us with clients who were not necessarily our community priority or our safety net priorities. There's just not enough clinicians to do the work across the board. So I think it would be pretty disastrous, and it would also delay services as individuals were shifting around between agencies.
Thank you, Carrie, for sharing that. And next, oh, I think hands popped down. There we go, Shanti.
Hi, I'm Shanti Rios, and I'm the Associate Executive Director for Center for Family Development in Eugene. And yeah, I think I was just trying to understand, you know, we as an agency might be able to refer internally. You know, private practices don't have that. And I just wonder, yeah, I mean, they may not if they're solely telehealth. And I just kind of wonder what kind of pressure there might be on those providers such as CFD that might be required to offer in person for some, you know, even at all. And will that be just additional pressures, you know, more referrals from external entities that aren't able to meet that in-person need? So mine's more of a comment, or I mean a question in addition to your question.
No, thank you, Shanti. We appreciate it. We really want to get as much feedback, and we know questions are going to come up from the information that we're sharing as well. And next we have Chilla with their hand up.
Thank you for taking my question or comment again. From a private practitioner perspective, the difficulty with this proposed plan would be for us to know who is providing in-person services. We don't have as much access to lists of services and what is happening with various agencies and what they provide in the community. And also, we don't have any specific listing available of private practitioners as to whether they provide in-person or telehealth or both.
Hi, Chilla. No, thank you. That's a great call out on that. A lot of questions that we don't have the answers for today. This is really just a space for us to collect some of the information and concerns that all of you have. So really appreciate that. And I saw a couple things that popped up really quick in the chat, and Frank put one that I wanted to call out. pointing to the question about the referral needing to happen within 2 days, and then calling out the time frame for the individual to be seen. Diane might be able to add a little bit more context to that. I don't think there's any language in place right now stating how soon that receiving provider needs to provide the services. So I will let Diane add a little bit more context.
Yes, thank you. And yeah, we had conversation about that very topic. Should we have something in rule that addresses that time frame? We didn't put that in, at least the proposed rule language at this time. We haven't finalized rules. So, I guess we would have to look back to the community of providers to see, what is a reasonable time period. One of the things we are looking at is the ability to capture the providers by specialty and their ability to see patients in person versus telehealth. I know that there are requirements within the coordinated care organization or CCO contracts that do have some of those requirements in their provider directories. But we do not have that for what we call fee-for-service or open card providers. So, those that's the provider population. But CCOs, I do believe, and Janet can correct me if I'm wrong, I do believe CCOs are required to have their provider directory have information about how they are able to, what modality they see patients. So thank you for the comments.
All right, thank you so much, Diane. And yeah, I also believe CCOs have that in their directory. We've been able to see a few of their directories again, but thank you. And we have Robin with his hand up.
Hi, I am a small private practice therapist in Eugene, and thanks, like everyone else, I want to echo the thanks for this opportunity. I, thought about your question, will this help members access services more according to the way that they'd like? And also, what are my concerns? And they overlap. So, I don't know that it will, because as others have said, there's the concern about just therapists available, not only for in-person, but in general. And I think that is, almost the bigger concern is how do we make sure people have services available, period. I, as someone who's done pretty much mostly telehealth up until now, and we'll see what happens, is I always ask clients, do you prefer in person, and try to refer whenever that is the case. So that's not new. I think most of us, if there's an in-person availability for a client or patient who prefers in person, we are going to make that connection, or at least I will. I don't want to serve someone through telehealth who doesn't want that. So for me, that wouldn't be a change. However, again, this requirement is, I know we're all saying this, is confusing and not specific enough. I don't know that it's a realistic expectation, because like others were saying, I won't repeat what others have said, but just in addition, availability changes moment by moment. I could get like 4 calls before I hear from someone else. So then I could be full, as well as other people. And, again, for private practice, 1-person operations, I just don't see how we'd be able to do this. We could certainly give some names, but, the names are available other places as well. So I just don't know if it is going to realistically mean that there's more access to in-person providers for clients, because who's out there is out there. And, I don't know that it's a change for telehealth providers to provide in-person referrals whenever that's possible.
Thank you, Robin, and especially for providing that context on how it can or may not meet the needs for the people. Appreciate it. And we are running a little bit slim on time. We'll take the next 3 hands that are up and we'll move to the next proposed change and have some conversation about that. Ian.
Hi. So yeah, I am a practice manager. We have 25 providers, and my concern is actually not for us because we do a hybrid model. It's for community mental health, actually, because I'm in the Portland area, and we'd be referring because we know that community mental health, such as LifeWorks, Cascadia, and the like, do in-person services. So I could see them getting flooded and having very long wait lists. So I could see clients having to wait a very, very long time to see a provider. If, for instance, one of our providers who didn't want to do in person would refer out. And that's my comment on that.
Thank you, Ian. We appreciate that. And Nancy.
Thank you. I just kind of reading some great comments in the chat. Going back to what Robin just said in answering the question, I think the issue is this question is tied directly to the resources in that community. So if there's availability and that client gets a referral and they're seen within, or gets a referral within 2 days and they're happy, right? But if they're in a county without those resources, we're going to have people who are very unhappy. We got this referral, nothing is happening, and I lost my spot on the telehealth list, maybe. So I'm not sure about why this rule is needed at this time.
Thank you for sharing your perspective, Nancy. Really appreciate it. And like you said, the referrals a lot of times are attached to those local resources, and it's going to be different based on what part of the state they're receiving services. So thank you. And we have Flora next.
Oh, can you hear me?
Yes.
Hello? Okay, sorry about the background. I'm actually multitasking in a store shopping. So I'm a provider, family physician from Albany. And my concern is that we've been doing telehealth for the whole time, and we cannot find providers. I mean, we do in-person visits too, so that's not a problem for us. But I know that right now, even for our providers in our county, some people have to wait for like a year to get in. Mental health is really a big problem. We see all ages. We have problems with all kinds of specialty. I mean, it's one thing saying that 2 days we have to refer out, but in terms of when are they going to get seen and addressed, I think that is going to be a big problem. And our CCO does have a list, but usually the list is not updated. And, they basically tell us providers to go down the list, and there are hundreds of people on there. And usually none of them are taking new patients. I mean, even for the county mental health, they have limited referrals where they will not do, certain managements, and everything gets punted back to family medicine. So I really think that, it's one thing to address and limit, the patient's need, but I think we need to take into account the resources available in the area. And also thank you for having this forum.
Thank you so much, Flora, especially for calling out based on experience working with the CCO directories and how the information's available, but sometimes it's not as easy to navigate and find the support that's needed. So thank you so much. And now we have quite a bit of comments in the chat. We are going to include this in a transcription for everyone to review, following up, getting all this good feedback and along with the recorded session. I wish I could go through all of them right now, but I really want to get to our next proposed change and get all of your feedback on that, which is going to be related to access. Diane, can you go ahead and share the information?
Sure, and actually this is not a change to the rules, but we wanted to invite some conversation around this because our existing rules and federal law requires that providers must accommodate language access needs such as interpretive services. So and so really the question from from your perspective as providers, have you experienced difficulty with having interpreters or interpretive services available for when you have those appointments with your clients or patients, whether those are in person or specifically via telehealth? So, well, looks like we've got questions raised.
Yeah, Flora. Flora, do you want to go?
Yeah, yes, thank you. Yeah, I was a little confused. Personally, I speak Spanish, at least medical Spanish and Chinese. But I recently discovered on the looking at our CCO's quality metric guidelines, it says something about how the interpreters had to be certified under OHA or some organization to be counted towards the, to meeting the metric. And I was a little bit surprised at that because, I actually had gone out and contracted with a group, but they are not the ones that are listed under OHA, under the PCPCH. I think recommendations. I think they had listed several agencies on there. So my question is, I just need some clarification, and I'm not really sure if this has anything to do with this, but we have a service now where you could get audio, video, or even in person, depending on the time allowed for the appointment. But can you clarify a little more in terms of, or maybe it's not you, maybe it's another body that would be able to answer this question. But I do find that, that is limiting, and if they're not allowed to use non-certified agencies.
Diane, I'm going to go ahead and see if you can address that.
Yes, thank you, Flora, for calling that out. I think I'm probably not the best person to answer that question. The interpretive services guidance and rules fall under our equity and inclusion division within OHA, and they sort of are the folks that manage that certified interpretive piece. So I think we'll have to take that question back to that group and get a clarification.
So Flora, we'll go ahead and flag that question and then come back and answer that as soon as we get more information on that interpretation services access. So thank you so much for your question. Perla.
Thank you. So yeah, I just wanted to comment that we've had many challenges with interpreters, in-person interpreting services. We've had patients scheduled for appointments, and then they call us like a little bit, an hour or so before, or the morning of the appointment, to let us know that they don't have an interpreter available. So what our university decided to do is to support bilingual employees who were interested in becoming qualified healthcare interpreters. So that way we are able to provide those services for our patients. And we've also contracted with a telehealth, with an audio interpreter service. So that way we, for languages that we don't have available, we just do video interpreting. And myself, I'm in the process of becoming a certified healthcare interpreter, also just to be able to assist our patients and not have to struggle, and especially for our students and patients with vision or physical therapy. You need someone there present to kind of describe. So it's really a struggle to not have an in-person interpreter. So our facility decided to go on the route of supporting employees who wanted to pursue their qualified healthcare interpreter. We're supporting them so that we can assist our patients.
Thank you, and thank you for bringing that lens into this forum. open forum as you work in the school system and are able to see what's working, what's not working, and especially the ways that you guys are thinking outside of the box of like, okay, if we can't get this language access, let's go ahead and train our staff to be able to assist our families. So thank you for providing that feedback. Yeah. Yeah, very wonderful. Anybody else that would like to add comments to that access? Yvonne.
Hello, thank you. Mine is more just a statement. I just wanted to share that we've had the same experience that Dr. Yao was talking about as well, as far as finding out last minute, like an hour before the appointment, even though we'd called and scheduled it, in plenty of time. So I just wanted to share that we've had that experience as well.
Thank you for sharing your experience, Yvonne. Any other feedback, thoughts, experiences with access, language access, in person or by telehealth?
And we do acknowledge that there might be some questions that'll come up later, some other thoughts. And if we don't have anything else to add today to the conversation, I do want to jump forward and go over the different ways that you can connect with us. A lot of feelings might be being processed right now, a lot of great conversation, different perspectives, experiences, and a lot of great ideas were shared that got us thinking on these different tangents regarding telehealth. So I really want to cover how you can connect with us to continue this conversation, how to engage with the telehealth policy changes. So first, in regards to today's open forum and some of the conversations, experiences, and thoughts, we would like you to send us feedback if something comes up to our community.outreach@odhsoha.oregon.gov email. That goes directly to the Community Partner Outreach Program. And we can always help connect with you offline and get you connected with other key players that can help better answer your questions and make the connection. Second, you are also able to sign up to receive notices about rulemaking, any activities, including the Rules Advisory Committee meetings that OHA offers and program updates. We are including the link in the deck slide that we will send to everyone after the session today, and we get the recording from today's session converted to a YouTube link for all of you to go back and listen to. Also, you can engage with OHA by going to our website, accessing any events, calendar. We'll have updated opportunities for the RAC sessions that we have that are upcoming. We will be having the public comment period for the telehealth rules specifically. Should be opening again April 2023, as we mentioned at the beginning of the forum today, and notices of proposed rulemaking will be published on the Oregon Bulletin as well for all of you to view. Once public comment is open, you are able to submit your written public comment during that period by emailing directly the hsd.rules@oha.oregon.gov. So again, if there's something from today that you want to continue and you really want to help with the impact, I would definitely recommend emailing them directly. Diane, anything else you want to add specifically with connecting with HSD and how they can participate in the RAC sessions?
No, I think you've captured it nicely. I mean, we did hold the RAC, had good participation there. That was at the end of January, and that sort of led into some of this additional community engagement efforts. So the next step is to take this input from today. We also have another session later this week with the audience target for community and OHP members. And And then the next step will be the notice of proposed rulemaking with that public comment period. So there's still opportunity for us to sort of refine any amendments that we're considering and to get public input from anyone. So.
Thank you, Diane. And I saw a couple questions about the contact information. We will email a follow-up again with the slide deck that has all of these inboxes for you to connect with. Alongside with that, I know the CPOP team will include our contact information as well. We can also include a team map and roster of who is covering what part of the state, so you can connect with them if there's specific questions, and they could serve as your bridge liaison to make connections with other individuals as needed. But for anything related directly to public comment and the telehealth rules, we are asking that it go through the public comment period. If you're needing additional guidance and possibly support and training for specific topics. I know at the beginning we had some conversation about understanding billing requirements, modifiers. This is probably a good question to bring to that regional outreach coordinator, that they can do a little bit of digging and find what supports and who to connect you with to get more of that one-on-one guidance for your organization. Any other quick questions that you all may have for us other than how to connect with us after this forum? Or any suggestions on how we can improve?
There's a question, Alma, from Lorraine. Is this testimony different than the testimony we have submitted to the Care Oregon survey site? I'm not aware that we have a survey going on, so this will be different.
Care Oregon's a CCO in the Portland metro area, is it?
Yes.
I believe. Yeah. So CCOs a lot of times will conduct surveys for them to collect data and better improve processes with them. Might be a good connection to connect with the CCO and kind of see what that platform's being used for, but it is different than our forum today. And I did create a quick poll that I'm going to launch for all of you. It's just to gather a little bit of information based on the group that we had join us today. And I'm launching it now, so you should be receiving it. If you can, please take a few minutes. Probably won't take it that long, and answer those 3 questions for us. Really want to get some feedback on how we can come back and improve and engage you all. And then other than that, we are all done for today unless there's any standing questions, concerns. Please feel free to connect with us afterwards. I will hopefully have this email with the materials for everyone by end of day today, if not tomorrow, as soon as I gather all the information necessary.
And we thank you for your time listening in and providing the feedback. It has been amazing to hear what's been working out in the communities, especially in rural communities. So thank you so much for joining us today and sharing that feedback. Thank you, Yvonne.
Yep, big thank you from everyone from the CPOP team and for the fee-for-service team that joined us today. And we hope to continue to provide platforms like this to engage in more specific conversations that you are all interested in. And I hope y'all can go get some lunch. I think we're right on time. So go get some lunch and disconnect. Don't answer emails. Walk outside if it's nice where you're at.
Yes. Awesome. All right. Have a great Tuesday, everyone. Gracias.